Good afternoon. Today we'll be talking about screening for genetic disorders in pregnancy. I'm Dr. Shreyasi, Senior Consultant Fetal Medicine at Cloud9 Hospital, Gurgaon.
And I'm Preety. I'm a director at Obs and Gynae Department, a gynecologist in Cloud9 Sector 47, Gurgaon. So today we are going to talk to you about prenatal screening. So Shreyasi, could you tell us a little about what really is relevant in prenatal screening?
Yes, so the reason we chose this relatively offbeat topic because this isn't really discussed much, while it is an extremely important thing that a pregnant or an expectant couple should know about. So many a times you would have thought that what are the terms like Down syndrome and thalassemia? What do they actually imply? Many a times, a few of you would have wondered that if your entire family is hale and hearty, then what is even the need of you knowing it or getting certain tests done regarding these particular conditions? This is one spectrum. While the other spectrum is where patients or the couples who do have children who are affected with genetic disorders are just left wondering that whether all this could have been detected while they were pregnant so that they could have taken an informed, conscious call about the continuation of pregnancy. So basically, genetics is a branch which deals with the genes and the hereditary problems. It becomes relevant in pregnancy because we want to screen or we want to diagnose, detect multiple problems which can actually have a lot of bearing on the life of the child. So there are multitude of tests that are available and the science has really evolved over the last 2 decades, and this comes as a ray of hope for all the expectant couples where we can detect so many things. The only thing is, it usually is very technical, very difficult to understand. So, this session is basically an attempt to kind of demystify the obscurities which pertain to these conditions and the tests which are usually done in the
And
pregnancy.
we'll try and explain these to you in very layman terms so that you can understand. But any questions, any doubts that you have at any time, please bring them up. Okay.
So,
I think we'll start taking your questions first, and they should, evolve the topic also. But in between, we'll keep giving you little more hints to the this thing.
so the first question that Supriya has for us is, what are the genetic disorders that are tested during pregnancy?
So pregnancy tests a lot of disorders. The first disorder that we start testing in early pregnancy is thalassemia itself. Thalassemia is a disorder of hemoglobin, which is checked in the first test that you go to the first time to a gynecologist. After that, as your pregnancy grows at 12 weeks, we screen for many disorders like Down syndrome. We screen for other disorders and chromosomal disorders like Patau's and Edwards syndrome. And also, we do an ultrasound to check for any abnormalities in the baby, which checks a lot of other disorders. There is also another important scan which happens at 20 weeks of pregnancy, and another test which can happen between 16 to 19 weeks, which is called as a quadruple marker. The level 1 ultrasound is also accompanied by a blood test which is called as a dual marker. So we'll be discussing all these with you in the few questions that come.
So, while answering, you did make a mention of Down syndrome. I think it would be good if you elaborate what is Down syndrome, because I think that is the most common question that is asked from expectant women from us, that what exactly is Down syndrome?
So it's basically a chromosomal error. Chromosomal error in the sense we all have chromosomes. We have 23 pairs of chromosomes, so 46 chromosomes. Any chromosome, if has two arms. So if there is an arm less or an arm more or any other disorder in any of the arms, these can lead to chromosomal disorders. So Down syndrome is a chromosomal disorder where the 21st chromosome has three arms. So it is called as trisomy of chromosome 21. And in this, there's a wide spectrum of the people who have Down syndrome, but basically they have intellectual disabilities, they may have some structural malformations, and also they may be, they have more chances of having diseases like Alzheimer's, their lifespan may be shorter. So they always do require support in their lifetime, and that is why it is important that such disorders are detected way ahead of time so that the parents can take informed decisions about what they want to do with the pregnancy, continue or not. Okay. So that's Down syndrome.
So just one thing I would add that Down syndrome is one of the most common genetic disorders to
That's
affect an individual. So that is why it would be rather screened that whether the baby
would be offered a screening for Down syndrome.
for Down syndrome. So then there is a question from Meetika. Is trisomy 21 same as Down syndrome?
Yeah, so that's the same as Down syndrome.
So just one more thing that trisomy means three chromosomes, which is the 21st chromosome in this case. And Down is actually the name of the British physician who actually found this disorder way back in 1862. And his name was Sir John Langdon Down. And that is why the syndrome is named after him. So it is in a way same. There are a few different types of Down syndromes, which are translocations where a part of chromosome is broken, and that is why there is some extra genetic material in the baby. Where more or less these two terms are used analogously. So this question, which is what is the difference between genes and chromosomes? So I think I'll take this up. So basically, gene is the smallest unit of inheritance. So we do understand that all our traits are determined by gene, how we look, how we function. Most of them are determined by genes. So these genes are just not loosely placed. They are placed upon certain structures which are called chromosomes. So if I have to take an example to explain, if pages are genes, books are chromosomes. And we all have a specific number of chromosomes, that is 46 in our species. So what happens at the time of cell division, from the mother and from the father, 23 each will come from either side in the form of sperm and egg. Once the sperm and egg combine, again 23 pairs would be formed. If there would be an extra chromosome, that would lead to a disorder. So I think that is the basic science behind it. So we can move to the next question. So next question is actually about the screening, what all we do in the pregnancy, where we have been asked that what are all the tests that you use for screening for trisomy 21 or Down syndrome?
So the first level of test that we use is at 12 weeks. So that is your ultrasound, which is the NT scan, where you're checking some fluid at the nape of the neck of the baby. And today the ultrasound has become more evolved, where you people are checking much more. You're checking the nasal bone also and the tricuspid. So part of the heart you're checking and some blood vessels. And that is going to improve the sensitivity of that ultrasound. But besides that, at that time we are also doing a test which we call as a double marker test. And in this double marker test, we are measuring two placental proteins, and that gives us a result of the double marker. And when we combine both these, that means we combine the ultrasound and the double marker, that gives us a high sensitivity for the detection of Down syndrome. So, Shreyasi, why don't you tell us about the next test? We have a more advanced test also available, which we can do around this
So
time.
what we can do is I'll enumerate the tests which are available for screening for Down syndrome. They include, like Dr. Preety rightly said, the first trimester scan or the level 1 scan or the NTNB scan, plus the double marker or the dual marker test. Then in the second trimester, we have the quadruple marker test. Then in the second trimester, the scan is also there, in which a lot of genetic markers are checked. It is called a genetic sonogram, or the same can be checked in the level 2 scan or the anomaly scan. There is another much more sophisticated test which is used for the screening for Down syndrome, that is called non-invasive prenatal screening, which is actually a blood test, but a more sophisticated one with a better confidence, we would rather say.
For Down syndrome, which has
Yes.
about a 99%
Yes.
sensitivity for Down
So,
syndrome.
so basically, these are all the tests which are
Screening
available
tests.
for screening of Down syndrome. And regarding diagnosis, we'll come later. Yeah. So the next question is, what is the right time to get the double marker test? And this has been asked by Asha.
So the right time to get a double marker test is anywhere between 10 to 14 weeks. But ideally, we do an ultrasound at 12 weeks of pregnancy, which is the level 1 scan. So the best time is to do it immediately after the ultrasound so that we can integrate or combine it with your ultrasound report, which increases the sensitivity of this test.
Okay. So the next question is, my double marker test shows a high risk for trisomy 21. Does that mean my baby is affected? Well, let me take this
I
one.
think Shreyasi should take this.
So this is a very major cause of concern when there is a screen positive, that the double marker test says that there is a high risk. So firstly, we should see what is the ratio. The way a double marker test is reported, there would always be a ratio like 1 in 50, 1 in 100. So, in case that test has come positive, it just means that it is valid for that ratio. It does not mean, firstly, that the baby has any problem. It does not confirm that. It has just flagged that this baby would need further testing. So, for example, if the ratio is 1 in 100, that would mean that a girl like you who would have almost similar features of while we are screening, among those, among similar 100 girls like you, one would
One
have a
person.
baby with Down syndrome. Now our challenge is we do not know whether that one is you or the 99, or you fall in a normal baby. So basically it can be an absolutely normal baby, it can be a false positive screen or a genetic expert. So we'll come. Why is it even called a double marker test?
Actually, it should be called as a first trimester screen marker, and that gives us the complete this thing.
Yeah.
So it's actually the first trimester screen which is more important. If we get a screen positive, that does not mean that your baby has Down syndrome, but that your baby, and we are only going to take next steps to check whether it is not that you should get petrified with that result. Babies which have had any challenges earlier. Or second is when we do the level 1 scan, that is the time when we come to know whether there is any risk. And again, at the time of the level 2 ultrasound or the quadruple marker test, we are again checking for genetic disorders. I think in all scans now, the doctors are always checking the baby. We see even in late second trimester sometimes. There are some defects which can be found, though those are rare, but at the same time, the baby is being constantly monitored.
So another question by Divya is, hello ma'am, myself married for 5 years. My laws.
As long as you got pregnant, I think maybe you didn't try hard enough. That's not a genetic disorder.
Yeah. So a question that has come, and I think we should take this up. That is, my entire family does not have any genetic disorder.
Mhm.
What test or what screening would I need? So take it up. So
Mhm.
it is not necessary that someone from your family should have a genetic disorder. Certain disorders are very common in the population, and they rarely, the type of inheritance or the way it comes to an individual is not that it runs in the families. See, you have to, it is far more complex than this. Like, there can be